Pharmacogenomics is a term that it takes into account pharmacology and genomics at the same time. So basically, it is a science that explains or tries to explain why there are differences between individuals in terms of response to medication. Why certain people will take, if you have a group of people with similar diagnosis, we give them the same drug, the same dose of the drug, and we find people that basically benefit from that drug and others will not. And it's not only getting the benefit, and sometimes some people will have side effects, others will not, for the same medication, for the same dose. So we are trying to explain why we have differences in the drug response, drug toxicity, efficacy between different individuals based on their genetics. Pharmacogenomics is one of the biggest, let's say, players when we talk about personalized medicine. Personalized medicine is one of the ways by which we can tailor medication depending on the different individual. We say that their genetics, taking account if they have comorbidities, if they're taking other types of medication. Now, if we talk about all of these at the same time, we're talking about personalized medicine. So pharmacogenomics is a very important part of personalized medicine.